Hey guys, welcome back to the Holistic Rehab Room. Today we're going over musculoskeletal conditions. The first condition I'm going to go over is herniated disc. So let's start with the etiology. It usually occurs in men aged 30 to 50 years of age. It can be due to improper lifting or excessive load. It can be caused by obesity. It can also be caused by repetitive activities that strain the spine, for instance, bending forward many times during the day, sedentary lifestyle. If you sit at a desk all day, you don't do any activities, you don't get up, you don't take a break, or you're laying down. Also, it can be caused by smoking. It's believed that smoking lessens the oxygen supply to the discs and causes more rapid degeneration. Also, you have frequent driving, so staying seated for long periods of time, and the vibration from the car engine can put pressure on the spine and the discs. And also poor posture, so if you have a flexed posture when you're seated, or you have an excessive kyphosis, excessive lordosis, things like that. Next, we have mechanism of injury. It is natural age-related disc degeneration. Disc degeneration. So, this occurs when there are subdural changes to the matrix of the nucleus pulposus and the inner annulus fibrosus. So those are the parts of the disc that will be affected. You have drying out of the disc. So as you age, we all have fluid or water in our discs, and at birth it's about 80% water, and as we age, the disc starts to dry out, and it doesn't shock absorb as well. It reduces the cushioning effect, which causes asymmetric distribution of the annulus. Also, you have injuries, which can cause swelling, soreness, and instability. There is an inflammatory process which mediates the matrix breakdown, and these are the pro-inflammatory cytokines, interleukin 1, 4, 6, and 8, and also prostaglandin E. Next, you have daily activities and sports can cause tears in the annulus fibrosis and excessive load at work. So if you're carrying and lifting heavy things at work, that can also affect the discs. Next, we have the clinical presentation. So you have the lower back pain, you have leg pain, which is more intense in the buttocks, thigh, and calf. You have paresthesia, which is numbness and tingling in the part where the affected nerves are. You have weakness, so muscles innervated by the affected nerve tend to be weaker. And then you have problems with bending or straightening your back. Next, we have lumbar spondylosis. Pathophysiology of lumbar spondylosis. Lumbar spondylosis is also known as spondylosis deformans or lumbar osteoarthritis, and this describes the overgrowth or the osteophytes which can be found at the anterior lateral aspect of the vertebral body or the end plate, more so than the posterior aspect of the vertebral body or the end plate. So what happens is when you get the new formations of the osteophytes, you get stripping of the periosteum from the vertebral body, and in the areas where the intervertebral discs are stressed. This is when you would see the bone spurs projecting horizontally at the margins, and this indicates osteophytes. Spondylosis refers to the degenerative changes of the spine. So you would see the bone spurs and the degenerating discs. The degenerative process is associated with aging, and the disc space decreases with disc degeneration, causing the disc to lose height. Lumbar ligaments hypertrophy and may calcify and impinge the adjacent lumbar nerve roots, causing radiculopathy. Additional degenerative changes include cartilage fibrillation and osteophyte formation, and degeneration of the zygapophyseal joints or the facet joints. The epidemiology is mostly in men ages 20 to 50 years of age. The mechanism of injury is traumatic spinal injury, aging, degeneration, and rheumatoid disease or rheumatoid disease. Signs and symptoms include increased lower back pain, morning stiffness, difficulty moving early in the morning, difficulty moving after prolonged positioning, pain, paresthesia, which is numbness and tingling, and weakness in the lower extremities if the lumbar nerve roots are affected. Next, we are going on to ankylosing spondylitis. Etiology. Ankylosing spondylitis is a chronic inflammatory disease which is caused by an autoimmune response that causes inflammation in the sacroiliac joints, vertebrae, and adjacent joints. Patients can have frequent inflammation of the entheses, where the ligaments, tendons, and capsules are attached to the bone. There are three processes that are observed at the entheses: inflammation, bone erosion, and syndesmophyte or spur formation. Furthermore, tumor necrosis factor is an important mediator of the inflammatory process. The epidemiology. It affects 3 times more men than women. The age is usually between 17 to 45, although I would say that may vary. Genetics, so if you have a family history of ankylosing spondylitis, and then you have the marker, so if you test positive for human leukocyte antigen B27 marker. Symptoms. So the symptoms are inflammatory back pain, stiffness in the back, pain and swelling, fatigue, limited flexion, and decreased spinal mobility. There are complications that can arise from ankylosing spondylitis. They include anterior uveitis, which is an acutely painful red eye, or you can get a fracture of your spinal vertebrae, which may be sudden onset of pain in the spine. Sacroiliitis. What is sacroiliitis? It is inflammation of one or greater than one of the sacroiliac joints. The causes are traumatic injury, arthritis, pregnancy, infection. What are some of the symptoms? The symptoms are vaporing on one leg more than the other, pain in the buttocks, lower back pain, and referred pain to one or both legs.